and is similar to what we have talked about, but this one is much more specific. So we are asked to look at the classification of diuretics. Classification of diuretics. So just list the class name, how it works, examples of drugs under. Go. So diuretics, you should know that they are actually grouped into 5 main groups. Okay, so you could just list the groups first. Try to develop a mnemonic that will help you remember the names of the groups. Alright, you cram it before later you now start knowing, okay, for this group let me know 2 types of drugs in it. They always try to know drugs that in a particular group that they have a similar ending. You understand? It will make you remember it more. So we have the loop diuretics. Okay, so those ones, they act at the thick ascending limb of the loop of Henle. Examples of drugs under this class include drugs like the furosemide and the bumetanide, the torsemide, and the ethacrynic acid. So if I want to grab any drug that falls under this category, I'll first of all try to know furosemide and torsemide. Furosemide, torsemide. You understand? So that's how you do. Later on, when you know like 2 drugs under a particular class, you move on to trying to know about 2 more. Do you understand? So that's how you do. But in the pharmacology exam, if they ask you about a class of a drug and you are able to list even 1 example, is okay. Right. So next we have the thiazide and the thiazide-like diuretics. Those ones, they act at the distal convoluted tubule and they will inhibit the sodium chloride symporter. So it will reduce the way what sodium and water is being taken back into the body. So it will make that what there's so much excretion of sodium and water. Examples: we have the hydrochlorothiazide, we have the benzoflumethiazide, we have the chlorthalidone, we have the indapamide, we have the metolazone. Okay. Potassium sparing, those ones, they will make it that urine is so much, but potassium is being retained back in the body. They act at the collecting duct. Examples of these drugs: we have the amiloride, we have the triamterene, we have the eplerenone, we have the spironolactone. Okay. So osmotic diuretics, those ones, they increase the osmotic pressure, so this will prevent water reabsorption. Okay. We have the mannitol, we have the glycerols. Okay. Carbonic anhydrase inhibitors, they inhibit carbonic anhydrase, so now decrease bicarbonate reabsorption. Okay. I have drugs like the acetazolamide and metazolamide. So grabbing those ones is very simple. But anytime they teach you about diuretics in pharmacology, just so that